This is the training for the January 4th, 5th, and 6th M2 Summative OSCE. This is the abdominal case. So I will first share the case. Let's see. Can you see that?
Yes.
Oh, great.
Yep.
So Robin, I'll help you read, but if you could start to read, or
Sure.
I can read the doorway instructions. So this is what the students will read outside the door.
Okay.
That Anthony or Abby Hudson, a 55-year-old male female, has come to the family practice clinic with a complaint of abdominal pain, vital signs, 128/70, temp 97.6, respiration 16. HR reminds me.
Heart
Heart
rate.
rate, I should know that one. 75 for a minute, regular pulse oximetry, 99% on room air. The student's task is to take a focused history, to perform a focused physical exam. They are not to do a full heat exam. They may check for pupil reaction to light and ask you to show you their conjunctiva while they leave their mask and visor on. Do not perform rectal, genitourinary, or female breast exam. And please write a note in the template on the computer outside the exam room. And you'll be writing your checklist at that time. So let's see. Here we go.
All right. So
Oh, I have to change the date on that case.
Okay.
Mhm.
So yeah, the OSCE 2022 case number 1. Palm 3 summative. So the scenario, your name is Anthony Abby Hudson. You're a 55-year-old baker. You want to get evaluated for an abdominal pain complaint. The objective of this encounter today is for the student to complete a thorough history and focused physical examination. The chief complaint, awful stomach pain, history of present illness. You've come to the doctor's office today because of an awful pain in your stomach that began an hour after eating breakfast. You ate 2 to 3 donuts, which is not your usual breakfast. They looked so delicious. If asked to point to where the pain is, you can point to the epigastric area, which is the central area below the sternum and above the belly button. Initially, this gnawing pain was a 4 to 5 on the pain scale of 0 to 10. It has been constant and has slowly been getting worse and is now a 6 to 7 on the pain scale. The pain is midline. It does not radiate. It increases with a lot of movement, like a bumpy car ride or taking a deep breath. You tried Maalox 2 teaspoons this morning, which did not help much. You have also been nauseous, started after the pain, and vomited 3 times. The first time you vomited, the donuts appeared. Then the next 2 times you vomited yellow bitter mucus, small amounts, no blood. Besides the nausea and vomiting, you feel that you have a slight fever, but you did not take it at home. You do sometimes have heartburn. For the last year, you've noticed some slight indigestion with fatty, greasy foods, but you usually take Maalox, which takes care of the discomfort. You usually do not take any medications, but have used Maalox for indigestion and occasionally take vitamins when requested. Your bowel habits have been normal in the past, i.e., no constipation, diarrhea, or pale stool, no blood or mucus, no dark urine, no history of jaundice, no weight loss, appetite is good. No fatigue or night sweats. Your last bowel movement was this morning before the symptoms started. You gave your daughter a donut to eat. No family members or friends who ate with you are sick. You have no burning with urination, no blood in urine, no back pain or history of kidney problems. You have no chest pain or palpitations, shortness of breath, leg swelling. You can lie flat and you don't wake up gasping for air. No cardiac history, no cough, productive sputum, chest pain, shortness of breath, dizziness, syncope. Past medical history. So medical history, you have none. The surgical history, you had LASIK eye surgery 5 years ago, no complaints. If female, LMP, not sure what that means. Age 52, no problem since. A mammo and pap up to date and normal. Normal colonoscopy at 50. If male, your prostate was checked yearly by primary care doc, no problems. Normal colonoscopy at 50. You're up to date on all vaccinations, including COVID and the latest booster. Family medical history. Your mother is alive at age 75 with no medical problems. Your father is alive at age 77 with gallbladder disease, operated on years ago. Your younger brother is alive with no medical problems. Medications. Take Maalox liquid as needed for symptoms. Also Tylenol, 500 milligrams occasionally for aches and pains, 1 to 2 tablets per dose. Allergies, no known drug allergies. Social history, you live with your wife or husband. A diet is okay, balanced most days with protein, carbs, fats, and fiber. Your stress, low stress, likes your job. Sleep is fine. Exercise, when able to, does go to the gym, not regular. No recent travel, you're a social drinker. You drink occasional wine, usually red, on weekends out. No cigarette smoking, no illicit drug use. Sexually active with wife, husband only. No contraception, no STDs. Review of symptoms, no other symptoms. Encounter at the beginning, from the beginning to the end. So during the physical exam, pain is in the upper center of abdomen, which is the epigastric area. It will be tender to touch. Your Murphy sign is positive. The student may palpate under your right rib cage and ask you to take a deep breath. You will try, but you stop because it is too painful. If the student palpates in your right lower quadrant over McBurney's point and asks if this is tender, the answer is no. If the student palpates in your left lower quadrant and asks if you feel pain in the opposite quadrant on the right, the answer is no, which is rovings. If the student asks you to raise your right or left leg off the bed against their hand and asks if this causes pain, the answer is no. Psoasis, SOS. If the patient asks if pain is worse when they let go after pushing into your abdomen, the answer is no, which is rebound. You do not have any tenderness if they tap over your kidneys in the back. Also, students may listen to your heart, lungs, and check your hands and feet. For the closure, number 1, short synopsis of your history. Number 2, short synopsis of your exam. Number 3, the differential diagnosis may include cholecystitis, gallstones, pancreatitis, peptic ulcer disease. Students should avoid jargon or immediately explain a term if they use one. Number 4, possible tests may include blood work, liver enzymes, pancreatic enzymes, complete blood count, US of upper abdomen, that's an ultrasound. Students should ask if this sounds okay to you. It does. Number 5, counseling may include advising to set up a colonoscopy soon, watch your fat intake, exercise more regularly, etc. Number 6, ask you to, do you have any other questions or questions?
Robert, just so you know,
Robert.
last menstrual period,
Ah,
LMP.
thank
Yeah.
you.
Sorry, I was on mute. I didn't even realize it.
Any questions, Robert?
No, I don't. I do recall that from my old notes here, I did this case before, that if we are asked, what, do you have any questions for me, that we could have a question to the likes of, do you think the donuts made me sick? Would you, how does that still
Perfect.
work for the
That's
case?
perfect.
Okay,
Yeah.
great.
Yeah, I like that they included that no one else got sick to eliminate food poisoning, but one of the things I think we should do is just go over a little bit of the physical exam portion, especially I do have one person who's pretty new and really likes to find out what these things mean as far as Murphy sign and the rebound and the different
Okay.
exams and stuff.
So I think the thing to take away from this physical exam is that there are 2 things that they respond positive to and everything else is negative, right? So
Right.
one is when they're feeling in, I have to stand up, right here where the rib cage finishes. So the rib cage is like this, and right underneath the rib cage, that's your epigastric area. So that's going to be tender when they palpate, right? But not tender that they can't keep, not so tender that they can't keep pushing around and feeling your belly. The other sign, which is Murphy's sign, is pretty close to over that. They'll move over under your right rib cage. You can all feel your rib cage right here on the side. And they'll put their fingers under the right side of the rib cage and push up a little bit and ask you to take a deep breath. And when you take the deep breath, you can either catch your breath and or say, oh, that's sore.
Okay. Oh,
So that's Murphy sign, and that's basically what we're really doing there is we're pushing up against the gallbladder. And if the gallbladder is inflamed and we push up and we take a deep breath, when you take a deep breath, your diaphragm comes down. So it's going to push everything down towards your hand, and you're already pushing up. So you're going to be squishing that gallbladder. That's the basic. So Murphy sign. All the others, McBurney's sign is down below your belly button to the right. That's for appendicitis, and that's not what this case is. So that area should be fine when they palpate. Anywhere lower abdomen or on the left side is all fine when they palpate. The psoas sign is the one where they lift your leg off the bed. Again, they might ask you to lift your leg off the bed. They're pushing down on your thigh, but it doesn't cause any increased pain. Sometimes that's positive because that muscle, that psoas muscle, runs up and down your back into your pelvis. So if there's something in your pelvis irritating it, that's why that would be positive. And then rebound is they're trying to see, have you got peritonitis? But you do not. So the only two things that are positive in this are epigastric tenderness, which is the upper center part of the belly, and the positive Murphy sign for the gallbladder when they push under your right rib and ask you to take a deep breath. And then, as I said, they'll also look at your hands. They'll be looking for the color of your palms. They'll be looking for, maybe they'll push on your fingers just like that to see what your capillary return is like. They might ask you to do this, which is looking for clubbing. And they'll probably feel your radial pulse, which they should feel directly down from under your thumb, right in that area. And it's okay if they feel pulses in both hands at the same time. The other thing they may do is have you stretch your hands out and look for a tremor. If you had a liver problem, your tremor might be like that. But all of those are normal. They may, even though when they're not taking off the mask, I'm sure a lot of them will feel for lymph nodes along your neck and your anterior and in front and in back. I'm trying to think of anything else. And of course, they'll normally, these are just the big things, but they'll do the normal stuff. They will look at your belly, then they will listen to your belly in 4 areas. Then they will, so we do inspection, we do auscultation, we do palpation, which is this, and percussion, which is when they tap, and they may tap from down on the right side over the lung down to the liver, and then from the right lower belly up towards the left side. But we'll just give them credit for any palpation. I'm trying to think if there's anything else on the checklist. I don't think there is. I think this is everything. Oh, and the legs. So if they examine your legs, they're going to look at them. They're going to feel the pulses down just below your ankle joints on the front there. And then they may also check for swelling by putting their finger on your shin, holding it for a second and seeing if there's any indentation. I think that's it. So again, just to recap, the most important things are that you had this episode of nausea and vomiting and belly pain after eating these donuts. No one else got sick, even though they ate the donuts. You've had some sort of symptoms in the past related to fatty foods, but no diagnosis of anything. And then now you have this episode, but no changes in what your stool looks like, no changes in the color of your urine, and you've never noticed any jaundice. And you're not sure you have a fever. You don't have a fever on the doorway instructions. Maybe you're getting one now because you feel a bit hot, but you don't have documented that. I mean, as I said, the most likely thing here, when you have pain in that epigastric area, the 3 things we think of are gallbladder, pancreas, and ulcer disease. So the fact that you have this positive Murphy sign puts gallbladder at the top of that differential list. Any questions? Robert, you're the only one. Although Eric, you might have questions. You need to get to know the language too, Eric.
No questions.
Okay.
No questions.
Okay.
But you got your perspective would be like an SP. Oops, Buster's upside up.
Yeah, I usually just look up things when I don't know them on these.
And you
things,
can
just
always
do a quick
email
Google
me.
search.
You can always email me.
Like syncope is insufficient
Syncope
blood
is for
flow to the
fainting.
brain, right? Syncope? Oh, that's
Fainting.
like
It's the fancy word for fainting.
yes, yes.
So on the checklists, we don't have it today because we actually revised it, but it's the similar things, Robert. It's communication skills, which would be, you know, do they introduce themselves properly by look and say their whole full name? Do they go about taking the history in a reasonably organized fashion and not jump all over the place? And you know, it's ask first 2 open-ended questions. So what brings you in today? And can you tell me more about that? And beyond that, I don't ding them for closed-ended questions because it's such a limited amount of time they have with you. Then they usually launch into, we have the mnemonic old cards, which is when did it start? Where's the pain? What's the character? All those questions. Then after they've done that, they will probably go into your past medical history, then your medications, your allergies, then usually your family history, then social history. And in that order, if they messed up one, it's okay. But if they're all over the place and they're asking you social history and then they're going back to medication and then they're going back to your past medical history, that's too much. They should know at this stage. And then they should, you know, make sure that they ask you if it's okay to proceed with the exam, and they make sure that you have the drape over your lap and that you're comfortable. And some will explain every bit of what they're doing on the way. I don't think they have to. We don't tell them they have to, but we do expect them to say, okay, I'm going to start with your head and your neck. And then now I'm going to have a look at your belly. Do you mind lying down flat? Of course, and for the exam, for the belly, you have to be lying flat. They can't examine you while you're sitting up. So I would expect that they would ask you to lie on the exam table, keep the drape over your lower body so that you feel modest, and ask you to pull the drape up towards your chest, and then do the inspection, the auscultation, the palpation, and the percussion. Pull the drape down, and then say, now can you sit up, please? And they could finish with either the hand. They may have already done the hands, but finish with the hands and the legs examination. And then say, although these students, you know what? These are second-year students. Oh, I will have told them the day before. So they will be doing closure, which will be, you know, here's what I'm hearing today. You had donuts this morning, and you were reasonably well up until this morning, when you had donuts, and then you had belly pain, nausea, and vomiting. No one else is sick at home. You've had something like this before, but today is bad. You came in to see us. On exam, I did indeed find that you were tender in that upper part of your belly, and you had a positive part of the exam, what we call Murphy's sign, which is when I pressed up under your ribs and it hurt. And that often tells us that this may be something going on with your gallbladder. So getting to what I think might be going on, my first impression is that we should look at your gallbladder. I don't know if you know what the gallbladder is, but it is a small little bag that hangs out near your liver, and it produces substances that help break down fats. But sometimes a little stone gets formed in there, and it gets stuck in the duct that comes out of that little bag, and then you get pain. And it becomes inflamed or infected. So what I think that's one diagnosis. The other one is, and it's a lot less likely, is that this may be some sort of a gastritis, that you have some chronic little irritation of the lining of your stomach, and now it's further irritated today. But nevertheless, I think what we should do is, I will take some bloods, if this is okay with you. I would like to take some bloods, which would include markers that would tell us if that gallbladder is inflamed. And we will also check maybe your white cell count and see if it's inflamed or infected. That would help us with the story. And we can do an ultrasound of that area. And we could start there. Does that sound okay with you? And you'd say, okay, that sounds fine. And then they would move on to the 5th part of the counseling, which is, listen, I'm really happy that you've kept up to date with everything. Just when you need to set up your colonoscopy, because I know that's sometime in the future, please know that our office here is great at setting that up, and we'll help you do that. Now, do you have any questions for me? And then you'll say, do you think this is the donuts made me sick? And you say, well, there is that possibility. it's less likely because everyone else didn't get sick. So it's not food poisoning. That is not to say that the donuts didn't precipitate because they're high in fat, and often foods that are high in fat can precipitate a bout of irritation and inflammation in the gallbladder. So they may be somewhat related, but I'm not, the top of my list of my diagnosis here is not food poisoning. However, we'll keep a broad mind, but we'll start with the ultrasound to make sure that the gallbladder is not inflamed. Good.
Great.
That's something what they should be saying. Okay.
Okay. And how long is the encounter?
25 minutes, Karen, right?
Yeah, isn't that what we changed it to?
25 minutes.
It's like
And there's
40
no
minutes in
feedback.
between each student, so you'll have, you know, a sufficient amount of time to do your checklist.
And is there any
25
verbal
with the
feedback?
student.
No feedback because it's.
Oh, that's right, this is summative, but
Yeah.
I'm sorry for your checklist. You'll have time, you know.
For the checklist, but no verbal, is that right?
No,
Okay. And then the drape, do you want us to preset it over our lap and be sitting up? Or is-
Robert, it all depends on how cold it is. Some
Okay.
days at New York Sim we are freezing, and other days we are like dying of the heat, and they have no control over it, unfortunately.
Okay, so you're
Wherever,
flexible about that.
You know,
Okay,
yeah, I think that you can, even if it's on your lap, you can still assess that they, you know, when you pull up the gown and the whole thing rides up, if they don't care, then you ding them, right? You just want to know that you're maintaining, they're helping you maintain modesty.
right.
thank you.
I'm trying to think of anything else on the list, on the checklist that will be, and we'll get this checklist out to everybody. It's not, as I said, it's not majorly different from any other checklist. So we do communication skills, and creating that relationship would be, you know, I'm glad you came in, a statement anywhere along the way. I'm glad you came in today, or I'm sorry to hear about that, if you say I have this terrible belly pain. And then making sure that they maintain eye contact, they don't interrupt you, they are never, ever to listen or feel over the gown. I think at the very end, then there's a global assessment. You know, what do you think of their professionalism? What do you think of their ability to take a history and do a physical? And I think on this one, on M2, that there is the one, would you recommend this student?
Would you want me to pull up from last year, or is that?
It's okay,
Yeah.
Karen, I think we'll only confuse things. As I said, Sean is making changes to that, and he'll get it at New York City, he'll get it back to us as soon as possible.
Yeah.
But I will say that the one about do not recommend the student, it would have to be an egregious, like they're not doctors, obviously, they're second-year students, and it would have to be like they never made eye contact and they were really rough or they were really rude, then certainly they need to be, you know, dinged. But if they're a little shy, or they make a little bit of a mess, but they recover themselves, then I think it's okay. Because they're bound to be nervous. It's their first time doing a Summative OSCE, which counts, right? And it's 4 cases. So I think we have to give them a little leeway for that. And it's being summative, it means, it really does mean that it's pretty serious if they fail. That's not to say that we don't want people to be dinged properly, but we don't need to be overtly crazy on them. Not that you're ever like that, Robert.
Yeah, that's true. You're not.
Ooh. I had a question and it went out of my brain. Sorry. Oh, I know. So the checklist that was attached to our email, we should expect that we're going to get an updated one or a different one than the one that was in the email that went out yesterday.
Yes, the
Okay.
checklist. We do not have the final checklist back yet. I don't think it's too different to what you have, Robert,
Okay.
but we want everyone to have the final one.
Okay, you got it.
Okay, team, case number 1 done.
Yep. Thank you very much, Robert. You're the spokesperson here, but and then I
You're
will,
welcome.
you know, you'll get the link so you could even watch it again when you're studying. So, 'cause
Oh, I
we're
don't need to see
recorded.
myself again.
And then do email me, like I'll be watching my email over the holidays, so do email me if there are any questions.
Great, thank
Okay.
you.
Robert, have a good holiday. We'll see you January 3rd.
Likewise, everyone
Okay.
enjoy it to the fullest. Enjoy
All
every
right.
moment.
You do the
Thank you
same. I
so
can't,
much.
looking forward to
I'm
seeing
looking
you.
forward to seeing you all as well. Thank you
good.
so much.
Bye.
Talk
Nice to
soon.
meet you, Michael.
And Eric,
See
and
you.
did you
Meet
get
you too.
introduced to
And
Michael?
nice to meet you, Eric.
Oh, okay.
See you
Yeah.
guys in at 10:30, right?
Yes, that's next.
Okay, bye.
All right, thanks.
Bye-bye.
Bye.
Thank you so much, Robert. I'm gonna stop the recording.
Guys, I just want to say there were supposed, oh, it's only us. You know this already. There's supposed to be